So thanks very much for joining me today, Linda. Can you please just start by introducing yourself for me?
So my name is Linda Greenwall. I'm a dentist and founder of the Dental Wellness Trust, a past editor of the FMC journal Aesthetic Dentistry Today. Before that, it was called Implant Dentistry, and also an owner of a multi-specialist practice in Hampstead with 7 dentists.
Perfect. And so you've just had a new book out. Can you please tell us a little bit about that and what it's all about?
Yes, so this is my 6th book, actually. All my other books are textbooks on dentistry, tooth whitening, aesthetic dentistry, practice management, MIH, white spot removal, resin infiltration. And this book is actually made with love, shall we say. It's the story of being in lockdown when dental practices were shut and we were at home for 3 months. Actually, the weather in the UK was awesome at that time, and I was in lockdown with my 4 children and my daughter-in-law, 7 of us, plus making meals for the family, 21 meals a day. And so I started collating all the family recipes and thinking about the times when we could be with our family because we were in lockdown. And I have 4 boys, and they all have different diets and different requirements. And so to cater to all of them, we were making lots of different meals. Then I thought about, I've also now recently just become a grandmother. I have 2 grandchildren. And I remember cooking with my grandmother and my grandmother's advice that she gave me about cooking. My mother always told me to get out of the kitchen and go and study. And I followed my mother's advice. So I never learned any cooking advice from my mother. And I was always studying, and many, many years of studying. But eventually one does need to be in the kitchen occasionally. Yeah. And so I was also trawling through our family archives and photos and collation of the stories. And what I found really interesting in the book was I collated stories of everyday heroes that do inspiring, amazing work. And when you really sit down, I don't know if you've ever done this, Lucy, have you ever asked your grandmother or actually spoken to her, give her a list of 20 questions, not how are you today, but tell me what it was like when you were growing up, to get her story, because those stories are so valuable, because our precious grandparents aren't with us long enough to share their amazing wisdom. And we want that. So that's why I collated the book. And what I loved was the handwritten recipes. So one day I was cooking, and out of my very old tatty recipe collation book, I found my grandmother had written her recipe on the back of an envelope. Quickly, it was for a no-bake cheesecake. Quickly, just written out. And so I thought, wow, they just write these out as all amazing. And so I collated that all together. So then we have to, as a dentist, talk about sugar and the issues about sugar. And we always have to actually practice what we preach. So we're always telling our patients, cut your sugar in your tea, cut your sugar in your coffee, how much sugar, how much snacking, etc. But then really we have to actually do it ourselves, and that's quite hard. And so this is so I did the same, but to cut the recipes. Now, in the olden days, sugar was a complete luxury, and everybody used to put a cup of sugar here and a cup of sugar there and sugar in everything. But realistically, no, we can't do that. But then my kids were complaining that the food didn't taste the same. And so we kept like halving the sugar or quartering the sugar until it was still had the same taste, but not didn't spoil the recipe. So we looked at that, and we looked at healthy eating. So in the book, they have the salad recipes, the starter recipes. These are my fun recipes. Then our traditional recipes as well, and the recipes from the grandmother. So my family come from Lithuania originally, and then they went to South Africa, and now we've been here in the UK for 30 years. So every journey that you make, you take the food with you wherever you go. And when you cook that food, and the taste of that food reminds you of the times that you were with your family or with your grandparents, or it's still the same taste most of the time. And so that is the purpose of the book. But the purpose of the book was really to raise funds for the Dental Wellness Trust, the charity that I set up 12 years ago. So currently we are looking after 58,000 children in 3 different countries. Here in the UK, we look after 38,000, actually it's a bit more, but about 38,000 children doing innovative toothbrushing programs in schools. We also go into schools and we do screening in schools. And those people who are listening today, and if you listen to it at any time, please come and volunteer with us. We need dentists, dental hygienists, dental nurses, dental therapists to all volunteer. Roll up your sleeves and come and help us. When you make a decision to give back and to help, you actually gain much more than actually is indescribable by coming to help. And Lucy witnessed our last outreach on the 15th of July, where we screened 350 kids and placed varnish on all those who consented. And it was an amazing experience. Lucy could feel the energy in the room and what was happening. It was a fun experience, and everybody enjoyed it. And the kids enjoyed it as well. The kids have been in our program now for 5 years. And this is the second time we've screened them, and they were very cool and relaxed. There was no tears, and it was quite a fun experience. We had the TV cameras there, as you saw, but in general, this is something that you can do to make a difference. And so we asked that. So we always need funds, and I thought this was a good way. All the profits from the book, everything, all the proceeds go straight to the Dental Wellness Trust. So that's why I wrote it. But it's really the story of my life. It's a bit autobiographical, and also it's the 30th year that I've been in this practice. It's actually nearly 40 years since I qualified as a dentist. Oh my gosh! So it's all the stories of my father instructing me on how to not be so timid when I was starting on my first day in dental practice with my father, and all the stories are there. We don't often get time to reflect because we're always going forward, but we understand life going backwards. We were always moving forward. But anyway, so it's a whole story, as I said, made with love. So I hope people will have a look. I'll send you the link. The link's on the Dental Wellness Trust website, www.dentalwellnesstrust.org, and go to store, and it's all over there.
Perfect. So you said that the profits are going to your charity then. What sort of
not only the profits, it's the whole proceeds. Everything goes to Dental Wellness Trust. So we also work in Kenya with 8,000 children doing the same toothbrushing program. And in South Africa, we work with 21,000 children. In South Africa, we have community oral health workers. We have 16 community oral health workers, which are also known as toothbrush mamas. So the toothbrush mamas go every day to the schools and help with toothbrushing, check on supplies, and check the children not brushing correctly. We also do screening and outreach in those schools, and we have 4 research studies. And again, anybody who wants to come and visit us in Cape Town on our outreach, the next one is in October and February, please message me. We'd love to have volunteers from the UK. We've just had this week, the last 2 weeks, 2 students, interns from KCL. And there is a little kitten just coming to say hello. It's not mine. Anyway. So we've just had two interns from Emily and Claudia from KCL go and do a research project and come and help with the toothbrushing in Cape Town. They had an amazing time. And that goes on. We also run 12 soup kitchens daily where we feed the children in our programs in the community. And then they do toothbrushing as well. At the moment in South Africa and Cape Town, the terrible taxi wars with the taxi in the territory, so they're burning the stores in the township, so everybody has to stay really, really safe. So that's our priority as well.
Amazing. Well, it sounds like there's lots going on then for you. Finally then, why should people buy your book? What do you think they could kind of get from it?
I think that, shall we say, there's some wisdom in it, not only the cooking. So you can look at the book in a few ways. You can look at it as just a recipe book and you follow the recipes exactly as they are. But remember that some of them from the grandmothers who, when they wrote down the recipe, they didn't always want to share the recipe. They would intentionally leave something out. So their food wouldn't taste exactly the same as their friends, shall we say. But we have tried these recipes and we know now that these ones work. And then my children have tried them, I've tried them. So most of the recipes are fine. But when you use recipes, there's always a little bit of creativity that other people put in, and everybody's got different ovens, and so you need to sauce and flavor and spice it according to your tastes. And then the stories are very inspirational. So especially the cake recipes. So yes, there are cakes. It's not a no sugar cookbook. It's got the wisdom of what to do, and also the story from my patients, which I found was really, really interesting. Some of our patients take semaglutides, which are it's a very popular drug these days. It's for diabetics to cut the sugar,
Okay.
but also not to be so not to actually not crave the sugar, and to not want the sugar. And then it fills you up quicker. So they take those medications, and we discuss how you can reduce the sugar. But then it's got the wisdom and the stories of everyday heroes, which for me, I interviewed a lot of people. They have inspirational stories, and so it's got that story. They always say, who is wise? He who learns from every man. So from my teachers are grew wives, but every day, as you know, we learn from everybody around us. We are always learning. So I collated some of that together, and it's all in the book.
Perfect. Well, it sounds amazing. Is there anything else that you want to add, Classly?
Really, just for dentists, for FMC readers, to please come and volunteer and help us. We set up WhatsApp groups with our outreach programs when we do that, and we'd love more people to get involved. We're also building a mobile clinic in Camden, mobile dental truck, which will go out to schools. But again, we need dentists to help us. So please be inspired to come and help us, and WhatsApp us, and Lucy will give all the details with the podcast.
Perfect.
Thank you.
Thank you very much.